The urinary subsection includes surgical procedures involving the kidney, ureter, bladder, and urethra. These codes are categorized first by body part involved and then by procedure performed, such as a cystourethroplasty, percutaneous renal biopsy, and urethroplasty. Urodynamics is the investigation of the function of the lower urinary tract, the bladder and the urethra, using physical measurements such as urine pressure and flow rate, as well as clinical assessments. Codes 51725 through 51798 describe urodynamic procedures that may be reported separately or in combination when more than one procedure is performed. Modifier 51 should be reported when multiple procedures are performed. And remember, modifier 51 is for physician use only. These procedures are performed either by the physician or under his or her direction. Here we have an illustration of the urinary system. Note the kidneys, bladder, urethra. If the physician is providing only the professional component, that is the supervision and interpretation for these testing, modifier 26 also should be reported for physician services. In general, genitourinary endoscopies are categorized by body part involved, urethra, prostate, or ureter, and specific procedure performed, such as a cystourethroplasty with biopsy of the bladder or urethra. Cystourethroplasty is also known as a cystoscopy, and it is an examination with a narrow, flexible tube-like instrument that's passed through the urethra to examine the bladder and urinary tract for structural abnormalities or obstructions, such as tumors or stones. Many procedures are listed so that the main procedure can be identified without having to list all the minor related functions performed at the same time. An example would be code 52647, which describes laser coagulation of the prostate, including control of postoperative bleeding. The description indicates a complete procedure that includes a vasectomy, myotomy, cystourethroplasty, urethral calibration and dilation, and internal urethrotomy. Minor procedures such as mediotomy, calibration, and so on are part of the code 52647 and should not be reported separately. This figure illustrates a urethral calculus with attempted uroscopy. When the MD or the physician states cysto, look in the CPT index under cystourethroplasty. Be careful with combination codes and be mindful of the urethra versus ureter description. If ureteroscopy performed with a cysto, refer to the code selection 52351 through 52355.